So now that you understand your population a little bit, ideally you've been working with them for a while, you understand their higher level needs, you understand what they're currently doing, their potential health outcomes as of right now, and you're starting to think about how you're going to design your intervention. You also want to start thinking about how will you know that you rolled it out. Once you have this is how we're going to implement it, how do you know if you actually implemented it the way you designed, and what kind of things came up during implementation that maybe affected the uptake of the initiative, and by association the impact of that evaluation as well. So process evaluation, it's mixed in with this implementation research, as in we are trying to figure out what actually came up during the rollout of an initiative and what helped that initiative be successful and what kind of stood in the way of just us rolling out that intervention. So is the program being implemented as intended? So you decided to do A, B, C, D, and E. Did you do A, B, C, D, and E? And if you didn't, or you didn't do A, B, C, D, and E the way you intended to do them, why? What came up? What were barriers to implementation, and what were maybe unexpected opportunities or successes with implementation that we can learn from as well. Okay, so think about what did you develop? Were you able to develop the things you wanted to develop, and did you distribute them the way you wanted to? Did you end up making changes to your original plan because of, something that came up? Right? How exactly did things roll out? You planned on hosting 3 fitness classes per week, 2 at this time, 1 at this time in this particular fitness center. Were you able to do that? No? Why not? Was it a building constraint? Was it that there was a manager that kind of stood in the way of that because there was some sort of competition with space because of some organizational culture stuff? There's all sorts of stuff, right? So when you actually started rolling things out, what came up? And how will you evaluate? This is part of the thinking of all of this. How will you evaluate if you implemented things the way you intended, and identify what were barriers and opportunities with that implementation? Okay. So for process evaluation, think of how you will know if you were able to do what you intended to do. So how are you going to keep track of how you rolled things out? Are you going to keep logbooks? Are you going to keep checklists? Are you going to ask survey questions? Are you going to conduct interviews with key people that help to identify why are things not going the way they did, or what are helping things go the way you intended them to go, right? Also, process evaluation, if you were to publish work on process evaluation, it's great because it can help other people foresee certain challenges. So for instance, like I said, let's say that there's that manager, it was all supposed to go fine, but this one manager, there's some sort of interpersonal thing going on, and they don't like that space has been allocated to this particular group, but you were able to have conversations with them, or to bring in some other people that help to kind of smooth things over and help the program run in a particular way. Well, that's important insight. And maybe you learned that with that manager and with other managers, you should have brought them in from the beginning, right? That's important insight for future people that are developing programs, to learn what kind of gets in the way of actually implementing the program the way you decided. Right? And something important about process evaluation, it's not about specific impact or outcomes. So it's not did people necessarily change their behavior? So did people increase daily step count by 10% or lose 3% of body weight? But it's more about program delivery, and then what affected positively or negatively that program delivery. Okay, so process evaluation, sometimes called implementation evaluation, sometimes called implementation research, right? There's overlap with all of those. You tend to conduct that as you're rolling out the program, and you're thinking about it even before you start rolling out the program, right? So the idea is the extent to which the program is being implemented as designed and whether the program is acceptable and accessible to the intended population. And the great thing about implementation research or process evaluation is that you can get early warning signs that things aren't going to go well. Before you invest more money or before you double down on a particular strategy, you can be like, whoa, this is a red flag, or this is a barrier that's already showing challenges and it's going to be a bigger one. I need to address this now, instead of figuring that challenge out 2 years down the line or 6 months down the line as well. And then also, like when you're discussing your program outcomes, your outcome evaluation, having this kind of research might give you insights into why you saw the results you did, right? So you wanted to run this program a particular way and you wanted to target all these people, but only certain types of people showed up and not enough of those people showed up. So you didn't show a great effect size. Well, that has to do with how things were implemented, right? It helps to also explain some of your results down the line too. And this slide, also from Health Program Planning Implementation Evaluation, where I've taken all my screenshots from for this particular unit, gives you some other ideas about process evaluation. So let's look at some of the process evaluation questions. What went on in the program? Did the program follow what was planned? What were the facilitators and barriers to implementing the program? And some questions around cost as well. And this slide also gives you some qualitative and quantitative analytic examples that gives you insights of how you can analyze the data you collect. So it gives you some ideas about strategies for collecting data as well as analyzing that data. And like there are papers published just on process evaluation. There are papers published just on like, this is what happened when things rolled out. Here are the results. Here are the specific numbers. Here are the results. Here are the emerging themes from focus groups and interviews, right? And these are some of the barriers and facilitators to actually rolling out that program. And I love process evaluation, implementation research because, you know, we already know what's good for people in a lot of cases. Like we know physical activity helps reduce the risk of just myriad diseases. But what does a well-designed and delivered and adopted physical activity health promoting program look like in specific contexts? That's what process evaluation and implementation research asks. It's like, what is going to allow this program that promotes this thing that we know is good for you, that has these higher level outcomes that matter to people? What is a program that can run effectively and ideally be scaled up as well? What does that look like in a particular context? And once we know that information, then we can design more programs like that or adopt different programs to different contexts and settings, right? So process evaluation is key to health promotion research, although people often get stuck just on like outcome evaluation, which is like, did people change their behavior? Process evaluation doesn't ask if people necessarily change their behavior. It's like, did they participate in the program? And did the program run the way it was supposed to run? And what were the barriers and facilitators of that? Okay, so in the next unit, in the next video, we're going to look at outcome evaluation, which is what most people think of when they think of evaluation, but we had to talk about formative and process evaluation first. See you in the next video.